We first looked into a population tool about 12 months ago when we were noticing the demand of our patients was increasing and the appointments that we had didn't appear to be enough for that demand. We were also noticing that our patients were sometimes inappropriately seen when they didn't need to be, and so it seemed sensible to have a look into the different population management tools to see if we could use segmentation to help that and get the balance correct.
As this segmentation Johns Hopkins ACG machine was developing, I was involved in it from its infancy. Johns Hopkins very cleverly divides our patient population into 11 segments according to their patient needs, and that is defined by how healthy you are or how many long-term conditions you have, your use of medication, hospital admission, use of the system. So really a lot of different ways in which information comes in put you in a segment between 1 and 11, and that divided into categories green, amber, red. Green being your healthy population, amber being if you've got a couple of health conditions or chronic conditions, and then red if you've got multiple complex health needs. We've got a patient population of just shy 19,000. They are made up of 68% patients in the green, 24% in the amber, and then 4% in the red, and then there's 4% that doesn't have a segment. This does not reflect how people seek help, right? So an interesting way of looking at this is our patients in the green accounted for some 41% of our telephone calls, and this translated to 43% of face-to-face consultations. Yeah, interesting. Our red patients are patients with a higher health need, more complex patients, accounted for just over 10% of the telephone consultations, and this translated to actually less than 10% of face-to-face consultations. There it touches on 3 key points for me: access, patient needs, and then dealing with your workforce. How do we optimize that? And I found the segmentation tool to be an ideal thing that brings all these 3 together. So what we did in our practice is do an educational session for these 3 separate areas, for our non-clinical staff, for the clinical staff, and I even had an extra session with our ARS roles, just for them to firstly understand what is segmentation, because it's really in the understanding. It's not asking you to do anything new or different, it's there already. It just helps you think that extra little bit about the patient in front of you. And so if you see a young person that is coming up amber or red, it should highlight this is not your average teenager or 20-year-old. What else has been happening in their life? We need to look at their care slightly more. Now we have clinical pharmacists, we've got paramedics, physicians associates, advanced nurse care practitioners. All have been in the health service, they're fully qualified, but now they're working within primary care. How we approach our patients and their needs are slightly different, and I wanted to help support them feel that we're getting the right patient choices right for their skill set.
The best way that we found that we can use the tool is starting with reception.
Jenny Groombridge, Thatcham Medical Practice. As a receptionist, we use the segmentation to signpost and help our patients. We can see on our screens if the patient falls into the red, amber or green category. We can then use this as a soft signal to help signpost the appropriate appointment. It means when we book the appointment, we have a signal of their background along with what they are presenting with. For example, if a patient calls up with a UTI, we can see if they're a green patient, we can signpost them to a pharmacy who can prescribe for uncomplicated UTIs. We can also use this in reverse. Sometimes a patient will call asking for a routine appointment. When we hear their symptoms along with their coloured category, we can always suggest speaking to somebody sooner if we feel it is necessary.
We have 2 doctors looking at all the on-the-day triage appointments and giving the patients a call to work out if they can help them over the phone, if they need to bring them in, if they can help themselves, if they need to be seen. With the red, amber, green segmentation, it makes it very clear as to those patients who are actually really sick, and they will run down that list and try and speak to the red patients first to make sure that they're being seen, and they're being seen early on in the day.
I use this day to day to help inform my clinical decision making, my triage decisions, follow-up plans for patients, and the type of appointment that we give and offer, and how we interact with the patients. When I have contact with a patient and I open their electronic health record, I will be presented with their segmentation score. Instantly I have an idea of if this patient needs something from us today, that potentially we could adjust the way we manage them on that day. For example, someone like a patient who is green 4, if their problem could be managed remotely, then potentially I would lean to that over necessarily in comparison to a red patient who might need more interaction with us before we make a final decision. The good thing about segmentation is that it's live, it's a dynamic being. So my encounter with my green 4 patient might uncover a new diagnosis, a new problem, and by inputting that problem into our electronic health record, that feeds back into the segmentation score, and the next time I deal with that patient, I might see them as an amber 9 and not a green 4. So that can inform our management going forward for me and the rest of my team.
Having the population tool has helped us to better stratify the way that we're doing the structured medication review. So before I might have called in the patients on 20 medicines first, then 15, then 10, but actually thinking about the red patients are at higher risk potentially of a hospital admission due to inappropriate polypharmacy. So if we can focus on those first, it will hopefully help reduce hospital admissions. We'd ask for advice and guidance from secondary care because that patient is more complex. So it helps us to make good clinical decisions, and that benefits both the patient and ourselves. I'm a prescriber, so I run a hypertension clinic, and for those patients, if their blood pressure is not to target, I think the red, amber, green approach has helped me to decide when it might or might not be appropriate to up-titrate medication. So for example, if the patient is green and their blood pressure is not at target, I'm quite safe to titrate their medication and hopefully prevent them becoming amber or delay the time at which they become an amber patient with other comorbidities. Whereas for those red patients, I might be less inclined to up-titrate medication because it could put more pressure on their kidneys, liver, and put them at more risk of adverse events. In our upcoming PQS work, we've got 41 patients in a cohort for structured medication review, and of those, 1 patient's red, 60% of them are amber, and then there's a few green. So we'll look at the red patient first, then move on to the amber, and then the green. And before we had this tool, we would have just maybe done them in alphabetical order. So our green patients, the number of face-to-face consultations has reduced, but our telephone consultations have increased. So we are addressing patients' needs in a different way, a better way, I would venture to say, sorting you out first time round. Our patients in the red category, we have actually increased our face-to-face consultations for them by almost 5%. And the initial data showing when we're reflecting that it's improved our hospital admissions, slightly reducing. So it's early, it's 1 year in, but it's early signals that is the outcome. The other opportunity that I feel for segmentation is in the prevention area. This is something that I'm really keen on. How do we keep you healthy? You know, if you're a patient that's in the green, how do we keep you green? That means earlier detection of pre-diabetes, that patient receiving that information, making the health changes, you know, losing a bit of weight, being more active, and not becoming diabetic. If you're borderline hypertensive, us detecting that, so you'll still be in the green. How do we keep you from not getting complications of high blood pressure? if you're in the amber section, yet again in this prevention space, if you've had one event, so you've had a heart attack or a stroke, how do we stop you from getting the second and the third? Because it's in every hospital admission that your health status is more complex. So if we identify you early, we treat you comprehensively, how we will be able to keep you in the amber section instead of progressing onto the reds.